Hey everybody, I'm Jeremy Sutton. Welcome to the Shreveport Bossier Local Lens podcast. I'm here with Dr. Berken at Highland Orthopedics. We're going to be talking about his orthopedic practice here in Shreveport, who he likes to treat, and his philosophy a little bit. Dr. Berken, thanks for being on the podcast.
Yeah, absolutely. Thanks for having me.
Yeah, man, that's great. So the first question I kind of like to ask is, why did you get into orthopedics?
Okay. Yeah, so I kind of joke about it. I feel like I'm almost a stereotypical orthopedic surgeon. So I grew up doing a lot of things with my hands. I grew up on a farm and on a rice farm in South Louisiana. So I did that growing up. Then I went to Rice University. I played football there. So I was an ex-athlete that then got injured while playing sports and had a bunch of surgeries. And then that kind of funneled me into being interested in the medical field. And originally my focus was, okay, I want to do this because I want to help athletes because they help me. And then that's just kind of turned into me treating people of all ages, obviously, and becoming an orthopedic surgeon. So that was kind of my road to this.
Yeah, I love that. I had a similar story when I was playing football in high school. I messed up a muscle and I went to a PT and I was like, oh, this looks cool. And I went down that path. I love that. So I wish I would have known. I should have brought you some rice. You grew up raising farming rice. You went to rice.
yeah, absolutely. Absolutely.
Well, did you know you were going to focus on the foot and ankle in school, or how did that come about?
No, honestly, that came about when I was an orthopedic resident, and whenever now the way orthopedics is used to be that everybody was mostly a general orthopedic surgeon, treated everything, and now things have become more specialized, which is great, right? So we all become a little bit more focused in on certain parts of the body, and so when I was going through my residency, I started thinking about it. Well, I kind of like doing sports, and I like doing trauma, and I like doing reconstruction. And what's cool about foot and ankle is you do all those things, but you're just doing it localized to the foot and ankle. So I kind of say I'm a general orthopedist of the foot and ankle, right? So I take care of all issues involving it, but it allows me to kind of keep that breadth of practice.
Yeah, I like that. It's funny because the more I think about medicine, the more I'm like, oh gosh, now I got to go to my general. Now I got to go to a ENT or whatever.
Yeah.
But in orthopedics, when somebody's cutting you open, I love that it's that concise because I want you to know every joint, every muscle, every ligament around the ankle.
Yeah.
So I love that. So I was looking at, and I know you do total joint replacements of the ankle. So I've been a PT 16 years. I think I've only ever seen one of those.
Yeah.
What is the benefit for somebody for a total ankle replacement?
So the gold standard for ankle arthritis. So we've had total knees and total hip replacement. Total hip might be the best surgery ever invented, right?
Yeah.
Like it's just people do well with it. Total joint replacement has led to changing the activity level that people are able to maintain later on in life. Well, the gold standard for ankle arthritis for the longest time was an ankle fusion. So now you take out all motion of the ankle. And that's still a viable option for people, and people can do well with it. But what we've seen over time is that if you take somebody that's got ankle arthritis and you do a good total ankle replacement on them, then they will have the same or better relief from pain standpoint as they would to an ankle fusion, and improved motion. So it allows them to have a more anatomic, more normal gait pattern, and it decreases the risk of them developing arthritis in adjacent joints, so other joints in the foot, which increases significantly whenever you fuse the ankle.
Right.
So they're not near as common as total knees or total hips, as you said. Now they're becoming more common because we're getting better at doing them. One of the issues with the ankle is that you've got, the total knee replacements, right? They're great, and there's certain things about them, but whenever you replace the ankle, you're replacing a joint right above. There's 25 bones below it in the foot, right? So there's a lot of joints in the foot that you have to make sure are all functioning appropriately before you do an ankle replacement. And so that's why it's not as common, but they definitely are life-changing for the people that they fit appropriately.
Yeah, I love that. I mean, I have seen a ton of ankle fusions, and it's never fun. Like I said, they can get better and they can move on, but I can remember people saying, "Gosh, now I'm wearing these boots to support my ankle, and I got a limp now, and it's just horrible." So I love that, and I know it is a newer surgery, so I'm excited to see where that goes in the next several years. What is kind of your philosophy on taking care of your people? I think I know you're kind of a servant leader and you kind of take care of them. Just talk about that a little bit.
Okay, yeah. I mean, when somebody comes in to see us, like the whole goal, and I say it a lot, and I honestly mean it. Like whenever somebody comes and I say, if you were my wife, my mom, my dad, my sister, whatever it may be, this is what I would recommend to you, because we want people to understand, like, our goal is for you to get better and to achieve whatever it is that you're looking to achieve. So, if you're younger and your goal is to, get back on the basketball court or running sprints or playing golf, like, what are your goals and what can we help to do? And you want to address somebody's problem without over-treating, without under-treating. And you have to take into account, what their lifestyle is like, what their health is like, what is safe for them to undergo. And so all those things are extremely important when you're treating people, not just like knowing, okay, just since we're talking about total ankles, you have ankle arthritis, I'm going to do an ankle replacement on you. That is not the way things should be looked at, right? It should be, you have ankle arthritis, how is this affecting your life? What has this changed for you? What is it preventing you from doing? And how can we help you to get to where you want to be? And if doing surgery on you is the right thing, then let's do it. And if doing surgery on you is going to put you at risks that aren't realistic to take, then we shouldn't do it, and we should go a different route.
Yeah.
And so that's how I like to approach every patient.
Yeah, I love that. I didn't space out when you were talking, but I was thinking about my own mom, right?
Mm-hmm.
So I brought her up here to see Dr. Feibel. I was stretching her a couple of months ago. Her hips, she had a fusion, she had something else done. She's had 3 back surgeries. The whole time I'm like, I think it's your hips.
Mm-hmm.
And so I went to stretch her hip, and I said, this is what we call a bony block.
Mm-hmm.
You need a hip replacement because she has 5 degrees of hip abduction. Yeah. So anyway, I bring her up here. He does her x-rays, and he goes, how miserable are you? And she's like, oh, totally. And I actually teared up as he's talking to her, because she's going to do both her hips this coming year. And he's like, this is going to change your life. And it is. And that's what I was like, this is what I've been telling you, because he's treating her how I would want my mom treated, just exactly like what you're talking about. And I think when we come at it from that viewpoint, because I always think about my mom, like,
right.
my dad's gone, but I think I ripped off a TENS unit off his butt one time, and he screamed, and he's like, do you do that to your patients? Like, only ones that have whipped me. But I would never do that to my mom, right? Because
awesome.
She's sweet and tender. And
Yeah.
So I love that you look at it that way. What does it look like for somebody to come in and say, hey, Dr. Berken, I found you online. I want you to look at my ankle. Kind of what does that process look like to go from not being your patient to seeing you?
Yeah, so the nice thing is, and so I've been here for almost 5 years, and we built an excellent team. So I have my MA that brings people back, that makes them feel like at home, addresses them, gets to know kind of what's going on. We get all their x-rays. I brought in an excellent PA that has a lot of experience in orthopedics, and been doing this for I think 13 or 14 years.
Wow.
And then me as well. And so we get them in here, we get their x-rays. One of the important things whenever you're dealing with foot and ankle surgery is not only looking at x-rays, and we try and get weight-bearing x-rays actually on a lot of these patients, because when you stand, everything looks a lot different with how the foot and all the joints in the foot kind of distribute versus if you're not putting weight on it. So anyway, so we do a very thorough evaluation of people, and just kind of figure out, okay, is your problem coming from the foot and the ankle or whatever? And I don't only see foot and ankle, but that is my specialty. But anyway, so that's what we're talking about. But I'm sorry, where else were we leading on this?
just kind of what it looks like to come in and be your patient. So you kind of went through, you have the MA who's awesome, you do the x-rays, you have the nursing, the PAs, and then what does it look like when you say, okay, hey, this is what we found, here's your options, we're not going to go straight to surgery.
Right. So especially in dealing with the foot and ankle, that I treat a lot more people conservatively than surgically, and that's because we deal with a lot of sprains, strains, tendonitis, just because you have so many tendons going past the ankle and so many bones in the foot and ankle, that there's a lot of issues that can be treated with immobilization in a boot, physical therapy. What types of modalities can we do? Can we change? Like, is your issue that you're overloading one area of your foot and maybe doing like a custom orthotic or something like that can help offload that area to provide you with relief. So there's a lot of conservative management that goes into that. So like I said, DME stuff such as ankle braces, boots, insoles, physical therapy, and steroid injections, and occasionally PRP injections and things like that for very specific issues.
Right. Awesome. So I think so I've interviewed you, Dr. Feibel, Dr. Byram. I was working at Ochsner when you and Dr. Feibel and Dr. Hogue came through as residents, so I got to kind of know y'all a little bit there. But talk about I think y'all have a really good group here.
Yeah, so I tell the guys that are ahead of us all the time that like what their vision for Highland Clinic Orthopedics has they've managed that unbelievably well, and they've tiered kind of like how we have our partnership, right? So we've got the guys who've been doing this for 30 plus years, and then we've got a group of guys who've been doing this for between 10 to 25 years, and then you have a large group of us coming up that have all been here for less than 10 years. But what that does is that gives us this super well, first of all, we're all friends, we're all super collegial, we're great partners to each other, but that gives our clinic as a whole just this broad spectrum of treatment options and knowledge, right? So it's great to lean on some of these guys that have been doing this for years, and they have this knowledge. You just go talk to them sometimes about complex issues, and they're like, oh, I've seen this many times. This is what works, this is what doesn't work. And so that experience many times is awesome. Whereas also some of the younger, some of us have started doing some maybe more newer modern techniques, and maybe they're better or maybe they're the same, whatever it may be, but it offers just a wide spectrum of treatment options, which I think is really good for patient care.
Yeah, absolutely. I mean, one of the things I have seen without a doubt is how good y'all all interact. Because talking to Dr. Feibel and Dr. Byram, but the other thing, y'all have Dr. Springmeyer here, who when I was 19 over in Ruston was doing ACLs, and they were just coming out like it was on the assembly line. I mean, they were just amazing. And I've been seeing his patients for 16 years who all do great. I've got Dr. Talbert. I've seen more of his patients than anybody else because I worked in Minden for a while. Just have a great group of people. It's funny you talk about, being able to go to, say, Dr. Springmeyer and say, hey, this is something crazy. Have you, oh yeah, I've seen that 3 times, and we did this 2 at a time. 2 times it worked great. The 3rd time, don't do this. Because when I was at Green Clinic, there's a PT over there, Gene Mariano, who I think is still there. And he was the guy, he had been a PT at 26 years at that point, so now 46 years. And I can remember they would go ask him questions. He'd be like, oh yeah, you try do this. And it would work. Yeah. And then they had Danny Jones, who had been a PT for like 20 years. And she would, I've done this. And so now I'm the guy, I've been doing it 16. And I just started using diagnostic ultrasound, and which is, oh my gosh, what a learning curve. I'm just going to spend, tell how much money just to learn how to use it. But it's a game changer. I was looking at, Dr. Goddess's ankle the other day, and I said, I think you have a ligament issue. And then his PA did the ultrasound. He's like, no, look, here's a tendonitis, here's a swelling. I was like, oh gosh, like this, it's a game changer. Like the technology that we have now is huge. And so I love to hear that there's kind of levels and tiers of where we are and using that. So that's great. What do you do? I know there's not a lot of these, but if something goes wrong with a surgery, like how do you kind of handle that with patients?
Yeah, I mean, and I usually kind of say before every surgery, I'm like, hey, listen, like there are possible complications. Anytime you do surgery, there's complications if you don't do surgery, right? What are the issues that can happen because of this? But, to me, the way I was taught and the way I practice is there always needs to be this honest, open line of communication between you and your patient. Right. And it's like, okay, this has happened, for example, an infection can happen. And those things can happen anytime anytime you cut skin, anytime you put hardware in something. Is there a possibility of some sort of complication? Yeah. But the most important thing is having a good relationship with your patient, an open line of communication, and addressing any type of complication, in my opinion, aggressively. So it's like, don't put your head in the sand and just hope things are going to get better. You say, hey, this is what we're looking at. This is how we have to address this. and you manage it. And if you do that, typically you can have a good outcome, even if you do have a temporary complication.
Right.
Yeah.
So I probably shouldn't say this, but I told Stephanie Ledoux one time, I said, anytime I can't get a doctor or a PA on the phone for a patient, I just tell them, say you think it's infected. And I said, you'll hear them running through the clinic. She's like, don't do that. But I did do that one time. I had a person who I knew was infected. It was a total knee. This is 10 years ago. And they're like, I can't get him on the phone. It was somebody. I said, hey, I'm pretty sure it's infected. And I guess she had on 10 name tags because I could hear her running through the clinic with the phone. And I was speaking to the PA next. And anyway, I don't do that anymore.
That's funny though.
But
it works.
But you do have to be aggressive.
Yeah.
And that's why, like, anytime a total joint or surgery, I'm like, hey, these are signs of infection. I know the doctor told you this. Don't hesitate to call them. They promise you they don't want to go back in and cut you open and wash you out and take a knee replacement out or anything like that. So, but anyway, what is something? This will be the last question. What is something you were excited about that y'all's group has going on, or you personally have going on that you want to talk about?
Well, as far as the group goes, I'm just excited about our continued growth. Right? You just talked about Dr. Springmeyer, and we had Dr. Springmeyer and Dr. England in the past year, both retired. I mean, those guys were just like, the just like standard of great patient care and taking care of people and just known in the community. And while I'm not excited that they're gone, because I miss hanging out with those guys and talk to them every day, what I'm excited about is that we're bringing on young people to just try and follow in the footsteps of what those guys have developed in this clinic. And I think that's cool to me. And it's just like, well, I'm not trying to recreate the wheel or anything. I'm just like, those guys set the standard and I just want to meet that standard, right? And so that's what I want to move forward with. And that's what I think is cool about in our group. And I think we're bringing on another guy in a year and a half named Dr. Sampanero. He's going to come join our group. He's just finishing his residency, so he's going to be an excellent addition. And then, like me personally, I'm always trying to learn new things, take care of new things. One of the things that we've kind of been doing more of recently has been like minimally invasive surgery for bunions and things like that in the foot and ankle, so that we can make very small incisions and give people the same type of correction that I would be doing through with larger incisions, but doing it in a more aesthetic way that people are liking, and we're able to progress them a little bit quicker too whenever we do those things. So that's kind of been like the new thing that I've been progressing with recently in my practice. I've been really happy with, and so I guess personally that's kind of been my thing.
Yeah, that's great. I mean, that's something my dad and I used to have a couple of rules. Don't mess with your eyes or your feet unless it's serious. So
that's fair. That's actually a pretty good rule.
Yeah. So, but how do people contact you and become a patient?
So that you can. I'm trying to get my phone number right. It's 318-798-4623, and just ask to get put in with Dr. Berken or my PA Sadie BB. She's been with me for 6 months now. We've got our team built, and we're trying to continue to grow it and treat people good.
I love it.
All right, man.
Thank you.
Yeah, thank you.